Good afternoon, friends. My esteemed younger brother, Vinod Bhandari, and my lovely Bhabhi, Manjuji, one of the two stars they have got, Mahak, the other star must be operating somewhere in his Mohawk future. In fact, I have come here to Indore. I have been coming here several times. When this medical school was started, till now, there have been several occasions I have come here, and every time, most of the time, I have delivered lectures of general interest. There is no point in delivering urological lecture to the young minds who do not know which side to go. So it's better to talk about the subject which is going to influence your future practice in India. I have come here to attend the annual Urological Society of India conference, and it reminds me in 2009 when I was the president of the Urological Society of India, my annual conference under my presidency was held here in Indore, and Vinod hosted one dinner for the conference. 2008, I was the president of Indian Medical Association, and coincidentally, that time also, the annual conference was held in Indore, about which Dilip was talking. And that time also Vinod was kind enough to host the dinner for all the delegates here in this sprawling campus of FIAMS. So, this is coincidence that I am here as past president of Urology Society of India to the city of Indore. And this morning was a very interesting session where we were talking only about future of urology and medicine. Lot of things you are doing here in IRCAD, which has been talked there this morning by luminaries coming from all over the world. One of the lectures was Future of Urology in 2035. My dear friends, our own Professor Mahendra Bhandari, who has visited this institute also earlier and now settled in USA, is the past president of the Urology Society of India. He delivered the lecture, this lecture, and he took us to the, wonderland of the fairyland of future of urology. All the sort of advances in digital world and all that, all futuristic part of it, you must be seeing here in your own institute. What is going to happen in future. But in that lecture, he mentioned one line, and I told him after the lecture, that we should not forget the person-centric medicine, which virtually the Western world is gradually forgetting. I remember my grandfather was a doctor. He was not only a doctor, but he was guardian of the whole locality where he was practicing. I was a little kid, and I used to watch him, how he interacted with his patients. Oh, somebody will come, he is a laborer, वो हल चला रहा है, उसकी वो आएगा, तो he will call him by his name. एंड तब पूछेंगे कि अरे तुम्हारी बेटी का क्या हुआ, तुम्हारे बेटे का क्या हुआ, वाइफ ठीक ठाक है ना, एंड आफ्टर दैट ही विल स्टार्ट आस्किंग उसकी समस्याएं क्या है. So he actually focused on the person who was coming for treatment and his background. Same was followed by my father. I have written in my chamber where I practice, your dedication to profession is my inspiration. He was dedicated. Other day, Vinod was saying कि मैं 2 रुपया फीस लेता था, तो that reminded of my father, late father. वो 2 रुपया फीस लेते थे, और फीस जो होती थी, जब मरीज देख लेते थे तो मैं रख के जाता था फीस, पहले फीस नहीं लेते. Things have changed a lot now. यदि आप देख लीजिए और फीस तो कोई देगा ही नहीं. हो सकता है जो रखा हुआ है सामने रखा रहता था, उसको भी उठा के चल देगा. That society has changed that way. लेकिन वो होता था, भाई भाई में झगड़ा होता था, तो लोग आते थे, चलो डॉक्टर साहब जो कह रहे हैं उसको हम मान लें. पड़ोसी पड़ोसी में झगड़ा होता था, लोगों में आपस में कोई झंझट होता था. सारी समस्याओं का समाधान मेरे पिताजी करते थे, और जो कह देते थे वही लोग करते थे. That was the respect he commanded. But then, था क्या कि सबको जानते थे, और सबका फैमिली बैकग्राउंड जानते थे, सबके बारे में जानते थे कि कौन क्या है, and accordingly he will give them the respect or the love what they commanded. Gradually वो मेडिकल प्रोफेशन से खत्म हो रहा है. I was in England when my father died, और मेरे ब्रदर इन लोगों ने एक लेटर लिखा था कि I never knew that your father was so popular till after his death. पूरी लोकेलिटी ने समझा कि they have lost the guardian. And उनका जो rituals था, that was done by the locality. You know, just because these people practice person-centric medicine, सबको जानते थे, सबका करते थे. ऐसी बात नहीं है. आजकल जो हम लोग हवा मारते हैं, बहुत बिजी, भीड़ हमने देखी थी अपने ग्रैंडफादर के क्लिनिक में, भीड़ मैंने देखी थी फादर के क्लिनिक में. कोई फर्क नहीं पड़ता था, सबको देखते थे, सबको एंटरटेन करते थे. ये जो हैबिट हो गई है, हर कोई बहुत बिजी, जिसको देखिए बहुत बिजी. एंड नाउ इन माय ओन प्रैक्टिस, आई वाज देयर इन इंग्लैंड फॉर 9 years, केम बैक टू इंडिया just with the purpose of serving my own people. And coming from Bihar, which was mostly laughed at whenever people were talking, अरे बिहारी हो यार, अब बीच में लालू ने तो और बर्बाद कर दिया. So that's a different story. But coming to, everybody was surprised there. You are so well settled in UK. You have the ECFMD. You could go to New York or anywhere in USA. Why are you coming back to Pakistan after 9 years? I said, this is my responsibility towards my people. बहुत अच्छा है, मेरी माँ भूखी है, मेरी माँ को कपड़े नहीं है. ये बड़ा अच्छा है जो प्रॉस्पेरस लोग के साथ बैठ के हाथ में एक विस्की लेके और माँ पर ताली आप भी बजा रहे हैं. अरे बिहार, हाँ यार, क्या बिहार में रखा, मतलब क्या मेरी माँ में रखा है. एटलीस्ट यू शुड, यू नो, try to do something for your mother. कम से कम कुछ तो कपड़ा ला करके दो, खाना दो. तो वो स्पिरिट लेकर मैं आया था. लोगों ने कहा बॉम्बे में सेटल करिए, हिंदुआ ओपन हो रहा था, उधर हो रहा था. मैंने कहा ना, मैं तो रहूंगा तो पटना में रहूंगा. और और इसमें हम लोग दो भाई एक ही हैं। विनोद का जो दृढ़ प्रतिज्ञ है, जो रोबस्ट ऑप्टिमिज्म एंड फेथ, मेरा भी वही था। आई केम विद रोबस्ट ऑप्टिमिज्म एंड द नॉलेज आई हैड, एंड आई सेटल्ड देयर and have practiced the last 43 years person-centric medicine. हर मेरे जितने मरीज हैं, maximum I know them, I ask them the questions pertinent to them. और एक एग्जाम्पल तुमको देता हूँ. Being a urologist, the worst kind of patients, because I see a lot of girls around there, the worst kind of patients, I mean suffering patients, I see are the women, the miserable women, suffering from so-called UTI, B. coli. They are branded that they have B. coli, UTI, and because they are women in the family, they are neglected by the whole family. If she is the daughter-in-law and her husband is at the border somewhere, or he has gone to some other place for service and the poor girl is being reprimanded in the family, she gets frequency in dysuria. I am not going to, that subject is different, sometime I will talk. And very reluctantly the family takes her to the doctor. Doctor is so busy, वो बिना माथा उठाए हुए, क्या हुआ जी? तो the mother-in-law will say, हमने से पेशाब करने जाती है. ओहो, यूरिन, ठीक देखा होगा कुछ नहीं, ना उसका बैकग्राउंड जाना, कुछ नहीं, यूरिन. अब यूरिन दिया, आगे गई क्लिनिक. तो यूरिन देने के लिए, अरे अब तो थोड़ा डब्बा भी है, पहले वो दे देते थे टेस्टिंग. जस्ट इमेजिन a woman giving the sample of urine in a डब्बा in the toilet. कभी सोचा है? Unsupervised. अब वो डब्बा को खोला, उसको पता नहीं है कि उसका ढक्कन को ऐसे रखना है कि ऐसे रखना है. एक हाथ में उसने पकड़ा डब्बा और दूसरे हाथ से साड़ी उठाई. अब इसमें कहाँ कहाँ कंटामिनेशन होगा पता नहीं. फिर then she is trying to collect the urine. In 9 out of 10 chances is there, maybe 100, that it will be contaminated. She takes that डब्बा to the pathology, और पैथोलॉजी वाला वो टेक्नीशियन यहाँ रख दीजिए, यहाँ नाम उम लिखवाइए, पैसा उठा दीजिए, जाइए. By evening it is put. So for culture क्या होता है? That contaminant grows during that period in the urine, अब वो इन्फेक्शन डाला जाता है और ये चक्र चलता रहता है. उस औरत से कोई नहीं पूछता कि तुम्हारा फैमिली बैकग्राउंड क्या है. उस पर टाइम लोग नहीं देते हैं कि कोई उससे डिस्कस करे. Sometimes I have to ask the family members to go out. Or if I take her to the examination room, I ask so many personal questions to her. It comes out that she does not suffer from urinary tract infection. She is thoroughly depressed. मेरी पेशेंट्स मैक्सिमम बहुत सी पेशेंट्स हैं जिनको मैं एंटी डिप्रेसेंट देता हूँ. ट्रिप्टोमार 2 फायदा करता है, तो ब्लडर को सेडेट करता है, और यहाँ माइंड में एंटी डिप्रेसेंट. 3 महीने के बाद आएंगी तो मैं कहूँगा कि अरे फिर तुम आ गई, क्या हुआ, देर आ गई. कहा कि सर जब तक वो दवाइयाँ खा रहे थे हम एकदम ठीक थे, फिर हमको जल्दी जल्दी पेशाब होता. सो आई जस्ट टेकन टाइम टू एक्सप्लेन टू यू that if you do not practice person-centric medicine, each and ये कंप्यूटर वाला नहीं है सब कि आजकल चल रहा है, फीड कर दिया, अब क्या डायग्नोसिस आ गया, क्या प्रॉब्लम. नो, इट इज डॉक्टर पेशेंट relationship, one-to-one. You have to give time to your patient to understand the family. That is called social determinants of health. Professor Michael Merman had been my very good acquaintance, where we were together for more than a decade in the World Medical Association. He is the pioneer of this social determinants of health. जब तक उसका सोशल, अब कोई बड़े सेठ जी आते हैं, उनको तुम दवाई दे दोगे कि ले लीजिए 1 रुपया का गोली आप खा लीजिए वो ठीक हो जाएगा, या वो पहले बनाते थे लोग, वो दे दीजिए, सेठ जी तो बिगड़ के दूसरे के यहाँ जाएंगे। ये समझना चाहिए कि सेठ जी को किस तरह से टैकल करना है और एक गरीब आदमी को कैसे टैकल करना है। तो दिस इज व्हाट पर्सन सेंट्रिक मेडिसिन, नो एडवांसेस in the world will replace this person-centric medicine. That is why we were just talking there. So now my lecture will start from this background, and now you will understand why I am talking about it. World Health Organization is also worried about it. They are doing a lot of things. So I'll just go through this lecture in this background. What is person-centric healthcare? Person-centric healthcare is rooted in universally held values and principles, which is human rights and dignity, non-discrimination, participation and empowerment, access and equity, partnership of equals. It is a system where efficient and benevolent healthcare organizations, competent and responsive health practitioners, and informed and empowered individuals, families, and communities mutually benefit from and contribute to person-centric healthcare. While health systems have diverse socio-economic, cultural, and political content, a person-centric approach to healthcare is relevant to and could be adopted by all forms of health systems at all stages of their development. Any health system can achieve positive changes and results with a judicious and appropriate use of current resources and capabilities. The paradigm shift in health system towards person-centric healthcare that restores harmony and balance to individuals, as well as harmony and connectedness between people and their environment, promises many potential gains. A paradigm shift in health system towards person-centric healthcare that restores harmony and balance of individuals, as well as harmony and connectedness between people, their environment. Sorry, ये दो हो गया. I'm sorry. The policy framework is designated and is designed as a menu of evidence-based interventions and best practices that promote person-centric healthcare and facilitate policy development and implementation at the country level. A policy framework will pave the way for cooperation and concerned action among all stakeholders at regional, sub-regional, national and local level. WHO Regional Committee for the Western Pacific and Southeast Asia reflect the need to pursue work in the following: equity and fairness to the policies. Equity समझ रहे हो ना, सबको समानता का अधिकार. Equity and fairness into the policy, the development of programs firmly grounded in ethical principles, the quality of health care and patient safety, human dignity, patients' rights and needs, and role of families, culture and society, ethics related to medical practice, research and education. The aim is to achieve better outcomes for individuals, families, communities, health practitioners, healthcare organizations and health systems. Well, what is person-centric medicine? It is like a quadrangle. The patient is in the center and there are 4 arms: individual, family and communities. Other arm is health practitioner. One arm is health system, and there is another one which is health care organization, which may not be medical or but it will be what called social aid for achieving the desired reorientation of optimal, holistic and person-centric healthcare in 21st century. 4 key policy and action domain. As I have told you, all these 4. Let's start with individuals, families and community. Support capacity building for better informed and more empowered individuals, families and communities who are able to actively participate in healthcare and in health system development. What is the requirement? Increasing health literacy. आपके इंस्टीट्यूट भी बहुत करता है, सब लोगों का हेल्थ लिटरेसी करने के लिए they have got many systems. Providing communication and negotiation skills that lead to meaningful participation in decision making. Improving capacity for self-management and self-care. Increasing capacity of the voluntary sector, community-based organizations and professional organizations to extend mutual assistance. Volunteer training and support programs, funding and all that. Now let's come to the second arm, the health practitioners. Competent health practitioners are required to deliver health care that is responsive to the needs, preferences and expectations of the people accessing health services. Healthcare organization. Third arm. Effective interventions at the organization level, specifically related to physical environment, service coordination and community care, multidisciplinary collaboration and partnership, patient education and counseling model of care, incentive for safe, quality and ethical services, and leadership capacity. Well, I will not go into the requirement. Now let's take the fourth arm, the health system. It is imperative to involve stakeholders not only in health sector but also in other sectors whose work impacts health outcomes and health status. मतलब कोई जरूरी नहीं है ये एनजीओ हो चाहे एरिया का मुखिया हो, सरपंच हो, ऑल दी लीडर्स हो, जो लोग इसमें हैं उनको सबको इन्वॉल्व करने की जरूरत है. Requirement: developing and strengthening primary care and the primary care workforce, putting in place financial incentives that induce positive provider behavior and improve access, and financial risk protection for the whole population. देखिए फाइनेंशियल रिस्क प्रोटेक्शन तो मोदी जी ने कमाल का किया ही है और हर स्टेट में दिस इज व्हाट इज हैपनिंग नाउ. देयर इज फाइनेंशियल रिस्क प्रोटेक्शन. All states are doing separately and there is a national Ayushman model. Building a stronger evidence base on ways to improve healthcare and health system itself to achieve better health outcomes. Ensuring rational technology use. This is very important. This is one subject on which I can talk for at least 1 hour. But that's it. Strengthening the monitoring of professional standards. That is also very important. Here, monitoring of professional standards is a must. Instituting public accountability measures for health service organizations, delivery and financing. Monitoring and addressing patient and community concerns about healthcare quality. Assisting people who have experienced adverse events in the health system. Ensuring protection of patient information. In conclusion, economic, demographic and social forces have increasingly put pressure on health systems to ensure that services are designed and delivered in ways that respect people's rights, needs and preferences for information, psychosocial support and participation in decision making for their own health and health care. ये बहुत, यदि आप patient and if the patient does not participate in the decision making for their health care, the job is half done. They have to participate. यदि ऐसा है बहुत बूढ़ा है, बच्चा है, या ये बहुत illiterate है, let the family participate on the behalf, चाहे mentally handicapped है, on their behalf. So that is very, very important, patient's participation. The need for innovative, balanced and holistic approaches to healthcare has become a matter of urgency for health system worldwide. अभी तो देखिए कि दो तरफ हम जा रहे हैं, just to conclude, दो तरफ है। एक तरफ हमारा इतना ज़्यादा जो कहते हैं एडवांसेस हो रहा है टेक्निकल साइड में, just imagine what is going to happen, and this institute is going towards that. Mohit has already operated in Paris, from Paris, for some other place. This is virtually here. People are the robots are operating in the space. So कल क्या हो? The surgeons, that will be virtually the things will be taken care of. The surgery part will be taken care of robot. लेकिन रोबोट को एम्पैथी, पेशेंट का राइट और ये सब कोई नहीं समझा। वो तो हाउ यू विल प्रिपेयर द पेशेंट टू गो फॉर रोबोटिक सर्जरी इज आवर जॉब, दैट विल नेवर गो। एआई विल ऑल्सो हेल्प अस। बहुत लोग पूछते हैं कि भाई एआई आने से हम लोग आउट ऑफ जॉब, नहीं, हम लोग एआई के आने से एकदम आउट ऑफ जॉब नहीं होंगे। हाँ, जो लोग एआई सीखेंगे नहीं वो आउट ऑफ जॉब हो जाएगा। तो एआई से हेल्प लेंगे, सेंटर में हम और पेशेंट ही रहेंगे। एंड व्हाट वी विल डू इन फ्यूचर, इट विल बी अ होलिस्टिक अप्रोच। बॉडी, माइंड एंड सोल shall be taken care of by our system of medicine. Ayurveda can, that is complementary and alternative system, yoga, this, that, lot of ये है, उन लोगों का मिल के they will holistically take care of body, mind and soul, and then surgical part will be done by the robot. That is the future which is coming. So our role is not going to lessen. Our role is going to be more. And those doctors who will practice patient-centric medicine, whether they are surgeons or physicians, they are and supported by AI, are going to be the successful physicians of the future. Thank you very much for your attention.